Good afternoon, folks. If you can hear me, we're just waiting for a few more folks to join, then we'll get started. As you can see, we're live streaming on Facebook. We're giving everyone another minute or two to jump on, so hold tight and we'll be with you in just a sec. Welcome, Gary. We're just waiting on a few more folks to join, and then we'll get started. And for those of you wondering, this is live streaming on Facebook, so there'll be a recording immediately available there, and we're working on enabling recording for anyone who's interested on this call, and we'll get started in just a minute. Thanks for your patience. Thanks again for jumping on, folks. We're just going to give this one more minute for Senator Casey to join, and then we will get moving. Welcome, Senator Casey.
Hey, Trey, how are you?
Good, good. Thank you for joining us.
Sure, thank you.
We are going live here for our press event here about major black lung legislation. Thank
Okay.
you all for joining us today. And my name is Trey Pollard. I'm just going to give some brief introductory remarks while everybody gets settled in. Today, we'll be discussing new legislation in the House and Senate that could change the lives of miners with Black lungs and their families for the better. Senator Bob Casey's Black Lung Benefits Improvement Act and Representative Morgan McGarvey's Relief for Survivors of Miners Act. We'll also be discussing the status of the Silica dust rule and one provision in the House that could derail progress that's been more than a decade in the making. Joining us today, we have Senator Bob Casey from Pennsylvania, Representative Morgan McGarvey from Kentucky's 3rd District, Gary Hairston, the President of the National Black Lung Association, Vonda Robinson, the Vice President of the National Black Lung Association, Courtney Rhoades, the Director of Policy, Courtney Rhoades, the Black Lung Organizer at Appalachian Citizens Law Center, and Quenton King, Federal Legislative Specialist with Appalachian Voices. Just a reminder that we are live streaming today. We will have a recording available after this. But to kick us off, we will pass the mic to Senator Bob Casey. Senator Casey, take it away.
Trey, thanks very much, and thanks for getting us started. I appreciate everyone being on the call today. We're here today because across our country, there are coal miners that worked so hard for our country, worked in their communities, kept all of their promises to their families, to their employers, to our nation, to power the nation. Coal miners got us through so many crises in American history, helped us win 2 world wars, and have given so much to the country. And it's about time that America kept the full measure of its promise to coal miners. And that promise was, if you go out and do your job every day, empower the nation and give us a standard of living that has been the envy of the world, then we're going to help you. We're going to help you when you need support after you've done your work. If you develop pneumoconiosis or black lung, we're going to help you with that. And too often that promise has not been kept by the federal government. We had to fight like hell just a couple of years ago on miners' health care and pension benefits. That was also a broken promise until we changed that by forcing the United States Senate to do its job and for federal officials to do their job to fulfill that promise to coal miners. But we have a lot more work to do when it comes to black lung. Just because there's been a black lung program for many years, for decades now, doesn't mean it's working. Too many miners are working waiting year after year after year after they've retired, after they've given the full measure of their labor, and we have not kept our promise to them and to their families. So we got to change that. We got to pass legislation to do it. And the legislation that United States Representative McGarvey and I are working on will be an effort to fulfill our promise to coal miners. As Trey made mention, this legislation has been introduced in both the Senate and the House. We're looking for even more bipartisan support than we already have, but we've got a ways to go. Too often, an issue like this, an issue that helps workers or retirees, falls down on partisan lines. We can't allow that to happen. I need to find, and those who have worked with me on this, need to find a Republican in the Senate to support the bill. So far, my colleague in Pennsylvania, Senator Fetterman, is working with us on this. Senator Brown from Ohio, Senator Manchin from West Virginia, and then both senators from Virginia, Senator Warner and Senator Kaine. So we have work to do to find that partner on the Republican side. What I don't want to hear from members of the House or the Senate is they really support coal miners, but they won't help coal miners getting the benefits they need or the health care that they need when they develop black lung. I don't want to hear that you support a coal miner when you're not willing to vote, as many did not vote, in favor of legislation to make sure that the Black Lung Benefits Disability Trust Fund was going to be solvent. We did that in 2022 in the Inflation Reduction Act, but that had to be done with the votes of just one party. So we need help from the Republican side to make this legislation law. Let me just finally just provide a quick summary of what this law is all about. I'll just summarize parts of it. If you're a coal miner and you've done all that work for years and even decades, you should have the benefit of the full record of medical evidence. That's not happening in a lot of cases. So the first thing this bill will do is require the full disclosure of medical information related to a claim, whether or not that information is entered into evidence. Second, this bill will prohibit unethical conduct by lawyers and doctors. And yes, that's happened too often in the past. Great journalism exposed a lot of that. If a doctor or a lawyer is engaging in fraud, or they're preventing a miner from getting their benefits, there has to be a sanction for that. And there has to be action taken against those members of the legal or medical profession. So that's part of this, preventing that unethical conduct. We want to make sure that every miner has, and retired miner has just a shot at getting the best medical care and attention they can. This can't happen without the passage of this legislation. So America, and especially our government, needs to keep its promise to these miners who kept their promise to their employers to do good work, who kept their promise to their families to provide for them. They kept their promise to their country, not just in terms of their work as miners, but many of them served in so many of our military conflicts. They kept their promise there as well. It's about time the federal government kept the full measure of its promise to coal miners. We can't say we're doing that unless we pass this bill. And so I wanted to introduce Representative McGarvey, who's been a great fighter on this, and look forward to working with him to get it done.
Thank you very much, Senator Casey, and thank you for all of your work. You've been a true champion of our miners, of making sure that our miners get what they deserve. And this comes down, this is really simple at the end of the day. You look at our area of the country, whether it's the Commonwealth of Kentucky or the Commonwealth of Pennsylvania, our area of Appalachia, we powered the energy revolution in America. We powered the industrial revolution in America. We powered the war efforts in America. And we paid for it. We paid for it in everything from the majesty of our mountains to the very lives, health, and safety of our miners, the hardworking men and women who went every day fulfilling their promise to go to work, to make sure that we were succeeding as a country. And we've got to be there for them. We have got to be there for them now. This is a moral imperative. And for the people who say that they support our coal miners, they need to get on board with these efforts to truly give the survivors of these coal miners the benefits that were earned, because they went down in these mines. If you've ever been down in a mine in Appalachia, you know what the conditions were like. You've seen it. And even with improvements made, there is dust inhaled and particles inhaled all day long. And those particles, that dust, they leave scars. And those scars develop all sorts of respiratory illnesses and black lung disease that result in death. And we've got to make sure that these benefits that are available through black lung compensation can actually get to the families of the people who've lost a loved one. I think the premise of this bill is simple. We've got to keep our promise. We have got to make it easier, not harder, for these families to get the benefits that their loved ones deserve. As we know, the research has established that this is harmful. We know what black lung is. Nobody's fighting over what black lung is. What we're fighting for is to make sure that the benefits they need are there for them. So I am thrilled to join the senators that Senator Casey mentioned, Senator Brown, Senator Casey, Senator Fetterman, Senators Warner and Kane, from Virginia, Senator Manchin from West Virginia, my colleague, Congressman Matt Cartwright, and others from the Pennsylvania area who are involved in this effort. I'm excited to be introducing and helping with the Relief for the Survivors of Minors Act here in the House of Representatives. And this is going to reestablish those rebuttable presumptions that were there before 1981, that a minor who died from a respiratory illness is presumed to have Black lung and is eligible for these benefits. This is going to go a long way in getting benefits to the families that need them. It's also going to improve legal representation. We know that the coal companies are going to fight back against their workers on this. And this is going to make sure that the attorney's fees are paid for as part of this. So again, the families of the people who died, the people who went into the mines every day, working every day, fulfilling their promise, and then contracting this disease because of the working conditions to which they were subjected, that their families get the benefits. It's hard enough to lose a loved one, to lose that primary breadwinner, but then to lose them because of what they were doing and have the federal government not fulfill its promise is something we just can't abide by. And finally, it requests a GAO report on the financial impact of these payments and other ways to improve the claims process to make sure we're getting this right. So I'm proud to join in this effort where we're going to make it easier. We're going to make it easier for families to get these benefits, not harder, where we're not just going to make this retroactive, we're going to be proactive. And in getting these benefits we deserve and calling attention to the problems that still exist and working to make sure that there's not one more case of Black lung, because our minors deserve no less.
Thank you very much, Congressman McGarvey. Appreciate your remarks and your action as well. I'm going to pass it over to Gary Hairston, president of the National Black Lung Association. Gary, over to you.
Yes, I want to thank Senator Casey and Senator Garvey for what they're doing for us. We really appreciate that. And like I say, we appreciate all the senators that's working on this. Like I say, we do need Republicans to try to help out. Seem like when we try to get them to help, they do it when they talking on TV or something, but then when it comes really down to it, they don't. On behalf of the coal miners, I like to say that even me, I was pretty lucky that the federal government started paying mine right off, even though the company was fighting it. But a lot of the guys that we work with seem like when they file for they keep on fighting. They have all the stuff they need, and when they go before a law judge, a lot of times the law judge don't really know what about coal mines, and they end up turning them down when they really got Black lung. And like I say, it's hard even to get lawyers to really help fight for this because they got to wait till the case is over to really get paid for it. And I know that in this bill that y'all trying to get for, that the lawyers will get paid some for that. And it's like I say, it's hard for a coal mine to get it. A lot of times they get it, then a couple months later they get a letter and they say they're taking it away from us. And we try to figure out why is you can get something 1 minute, then they can turn around the company and say that you ain't got it when you got all the proof that you need. Then it comes down to you fighting the case all over again. So we really need to even try to find out why that a company could come back even a year later and tell you that you ain't got Black lung and end up taking it away what you got. Then they want their money back. And that was tough for a lot of coal miners, because I know a lot of that is in our organization. Some of them been fighting for 10 years. They try to get it. It seemed like the company do everything they can to hold out, hoping we'll die. I even talked to some of them that got it, and they quit trying because they say, "Why should I try every time I try?" They say I ain't got it, and it's tough when somebody tell you, and you got doctors, and the lawyer you got tell you got it, then they come before the law judge or whatever, then they say you ain't got it bad enough. And like I said, that's what's really hurting us this day. And so I'm hoping that in this bill that we can get all this doing. And like I said, I really appreciate what y'all doing for us. And anything we can do to help y'all, to help us, that's what we'll try to do. We can turn that over to Vonda now.
Okay, my name is Vonda Robinson. I am the Vice President of the National Black Lung Association and also President of Chapter 2 in Southwest Virginia, Big Stone Gap. Can you all hear me? I still see Gary.
We can hear you, Vonda.
Okay. And I want to thank Representative McGarvey, and I also want to thank Representative Cartwright for all that you're doing. This has been a passion of mine for years. I have worked closely with Senator Warner for years, trying to get this for the survivors, for the widows. And I am so happy that it's actually in the House. And I want to thank you both so much because I'm actually working with 15 widows right now in Southwest Virginia. And just to hear their experiences, just of losing their husband alone, but also when they actually get their benefits taken away. I mean, it breaks their heart because they've seen what their husband went through in the coal mines to help Pair America and stuff. And, you know, just losing them is hard on them. Plus, when they actually get the benefits and it's actually taken away, I actually made a house call probably about 3 weeks ago. And she was 83 years old. Her husband died 2 years ago. She was drawing benefits. She's deaf and she's blind. So we actually had to work off of a eraser board. And she was trying to talk to me and she was crying. And she said, you know, my benefits are being cut out. And she said, they're my children, my grandchildren, my great grandchildren. She said, what am I going to do for Christmas? I mean, she was crying and I'm sitting there crying with her. And I'm thinking, you know, this shouldn't be this for them. And I've worked so hard trying to get this for these widows and just hearing their stories of what they went through, you know, and I'm also a wife of a miner. My husband was diagnosed at 47 years old. He's 57 and he's looking at a lung transplant. You know, I don't know. I could be in those shoes one day. And just to be able to help those, to let them see, you know, I'm here to help you. And we have got representatives now that actually is introducing it to the House. And I mean, I'm so excited to let them see there is hope, that we do have people working with us. And I mean, it's just heartwarming if you sit with them. And, you know, I do, and I hear their stories. And to get this passed would mean so much to these widows and to me, because I've worked like with Senator Warner and Kane on this for years. And actually we actually had it in the House before. It didn't go anywhere. Now we're getting it in, you know, it was in the Senate, but we hadn't gotten the House, and now we got it in the House, and I'm excited. So I want to thank you all so much for doing this and what this is going to mean to these widows in Southwest Virginia and, you know, all over the United States, because, you know, we have to have help. And I want to thank you all so, so much for doing this for us. Thank you.
Thank you, Vonda, for your leadership on this for so long. We'll pass it over to Courtney. Courtney Rhoades Mullins from Appalachian Citizens Law Center.
Thanks, Trey. Thanks, Vonda and Gary. Over 4,000 cases of advanced Black lung have been diagnosed since 2010. Every day, I have the extreme pleasure of working with individuals and members like Gary and Vonda, and I see how Black lung is ravaging our communities in Appalachia. Several clinics that we know also report minors as young as their 30s and their 40s being diagnosed with a severe form of this disease. This incurable and preventable disease is stealing the breath from minors' lungs as they are faced with the difficulty of trying to operate the Black Lung Benefits process. The Black Lung Benefits Improvement Act and the Relief for Survivors of Minors Act are a step in making this process more accessible to minors, widows, and their families, and this legislation will encourage more attorneys to assist in cases like this. The medical benefits of this program are a huge blessing to minors who need constant care for the remainder of their life, including some who are going to have to face, like Vonda was saying, the difficult process of a lung transplant, which can cost millions of dollars in medical bills without these benefits. However, the current monetary benefits are insufficient. They have not kept up with the recent inflation rates, with a minor and their dependent only receiving $1,106 a month to survive on. That means for a family of two, they must decide how to budget a meager $13,272 a year without considering retirement or other such funds. As younger miners are diagnosed with black lung, they face the difficult decision of whether or not they remain in the mines and continue to be exposed to coal and silica dust, or having to learn how to survive on a significant pay cut. Miners who are physically unable to continue working and must exit the workforce in their 30s due to the disability occupational disease lose out on more than $1 million in gross wages over the course of their life. This is the reality for thousands of individuals living and working in the coal fields of Appalachia. We'd like to take this moment to thank Senator Casey, Representative McGarvey, and their co-sponsors for being voices for the coal miners and their families. We definitely could not do a lot of this work without your support. I also want to take a moment just to say thank you, Vonda and Gary, for your continued leadership at the National. Y'all do a wonderful job, and I'm so thankful to know you. I'm now going to hand over to Quenton King from AppVoices.
Thank you, Courtney. And I'll echo what Courtney said. Thank you, Senator Casey and Rep. McGarvey for joining us today and introing these two bills. It means a lot to us. And I also want to thank the other co-sponsors on the legislation and want to point out that the Relief for Survivors Miners Act will have co-sponsors from not just Appalachia. So that shows that, that members of Congress care from across the country and they recognize how important it is to take care of coal miners. And lastly, we'll definitely thank Vonda and Gary for joining us today. I've learned so much about advocacy from you all. It's been a pleasure to know you all. So I would like to finish out by just saying what comes next regarding this legislation and other Black lung advocacy at the federal level. So I will touch on the Silica amendment that Trey referenced earlier in the call. So as many of people on the call know, that an important rule was announced this summer that could go a long way toward preventing Black lung disease in current and future generations of coal miners and reduce their exposure to silica dust. For decades, health experts and miner safety advocates have been asking the federal government to reduce the level of silica that miners are allowed to be exposed to. They are virtually the only industry allowed to be exposed to silica at the levels that they are exposed to. So in June of this year, MSHA finally proposed cutting the limit in half, which would bring it in line with all other industries. Health experts, AppVoices, other mine safety advocates identified gaps in the rule this summer, and we were able to raise them to MSHA, to Congress members, whether that was in hearings, official meetings, media interviews, and in written comments as well to MSHA. And we raised those concerns. And we're hopeful that MSHA will take those comments into consideration when they release the official final rule, hopefully by next April, a stronger rule. But unfortunately, before MSHA even has a chance to incorporate Black lung and other miner advocacy feedback, Representative Scott Perry has followed the lead of coal executives and proposed an amendment that would block MSHA from implementing the rule. And Representative Perry introduced this amendment in the House Labor Appropriations Bill a few weeks ago, and it passed by voice vote. So what this would do, it would block MSHA from appropriating any funds to implementing the Silica rule next year. So this is extremely disappointing. Thousands of coal miners and other miners stand to benefit from silica protection. But if this rule can't be enforced, that means that just even 1 year could lead to silica exposure that could lead to Black lung disease in a miner's life. So we are very concerned, disappointed by that amendment. And we hope that the Senate holds strong and is not able to include that in their appropriations, or that the House will cut that in January when they are doing appropriations January and February. So back to this legislation, though, we're super excited that we're super excited that Rep. McGarvey was able to introduce this bill today. This is the first time that the House has introduced the Relief for Survivors Miners Act. So we're really grateful for the cohort that has put it together. we're urging the Senate Health Committee and the House Education and Workforce Committees to hold hearings to pass these bills in the upcoming Congress. And we're excited to work with the Black Lung Association, Gary, Vonda, the local and national chapters, and other advocates around the country in trying to raise awareness about these issues and these two bills. And I'll kick it back to Trey.
Thank you, Quenton, for everything you've been doing on this as well. All right, folks, we're going to do a quick Q&A session. So thank you to everyone, all the panelists for speaking. Thank you to Congressman McGarvey and Senator Casey for their leadership on these bills. If you do have a question, please raise your hand. I see we've got one hand raised already from Sarah Bowden. So we will unmute Sarah. Dana, I'll let you do that.
Hi, thanks so
Sure.
much for taking my question.
Yeah.
So I guess I'm just a little confused. There's discussion about benefits. I was hoping you guys could talk a little bit about what benefits you're referencing, like who provides these benefits. And then there's discussion about the benefits being taken away after someone had the benefits. Like that was all really confusing to me. And I was hoping someone could just kind of flesh that out a little bit.
Quenton, you want to take a crack at that?
Yeah, sure. And Courtney, please jump in. So the Black lung benefits are provided by the Department of Labor. And so if a coal miner suspects they have Black lung disease, they're able to apply for the benefits. And it's an adversarial process, which is why these two bills are very important. The coal companies are allowed to say that the miner doesn't have Black lung, or they didn't get it from this coal company, got it from a different one. So it's a very complex process, but essentially if a coal miner wins the benefits, they're able to receive a monthly monetary stipend that is adjusted according to how many dependents you have. And you also are entitled to health care related to Black lung disease. And that is for the rest of your life if you're able to receive the lifetime benefits. But as Courtney said, for the Black Lung Benefits Improvement Act, that the stipend is relatively small. It hasn't kept pace with inflation. And also it's hard to get those benefits because attorneys may not want to take those on because you can't get paid until the process is over, which can take 5 to 7 years to fully go through the system. And also, and I would let Courtney or Vonda talk more about this, but a surviving dependent is able to apply for the benefits if their loved one died of what they suspect was Black lung disease. So maybe Courtney or Vonda can jump in there.
Yeah, Vonda, do you want to go? You want me to?
It's whatever. We can both, if
Sounds
you
good.
want to.
I'll just do some quick, just to flesh out a little bit more of what Quenton said, and then I'm sure Vonda will have more to add. Just to give you a heads up a little bit, so the medical coverage of those benefits will cover any type of respiratory care for the remainder of someone's life. So that includes a variety of things, since respiratory often affects the rest of the body as well. To discuss the inflation and the monetary benefits, to give you an example, last year during a time when we know inflation and the cost of living rose by a significant amount of percentage, Social Security was provided an 8% raise. The Black lung benefits was only provided a 4% raise. So that's a very significant difference. And we saw that a lot in the way that that system is made. And so making those changes would be so beneficial for so many people. And then for the conversation about benefits getting taken away, this is why this program is very difficult. A lot of people don't understand what this is about. To provide you, as Quenton was saying, if the Department of Labor, you go to an exam, they find that you have Black lung at the exam, you start receiving something called interim benefits. That continues if you're a trust fund case, which this is getting very convoluted and I apologize, but I'm more than happy to talk to someone offline as well. And I'm sure we also have materials I can provide you, Sarah, but if it is a trust fund case, they are paid out of the trust fund. This is once you're determined to have Black lung, that's typically the end of the road. You get your monopoly money, you win. If it is against a coal company, those cases take longer, as we know. You receive interim benefits, so they provide you the monthly stipend as well as the medical benefits that you need to help someone continue to get the care that they need. However, in the cases where these interim benefits, if you're found by a judge to not, no longer you're ruled against that for some reason, you lose those benefits. And then just to clarify, the survivor only receives, you have the opportunity to appeal for those benefits though and reapply as well. And then just lastly, to clarify, the survivor only receives the monetary benefits. They do not receive the medical. I hope that covered kind of some additional information.
And just follow up. So why is it so adversarial? Is it that because you'd mentioned that there's sometimes a fight over like where a miner contracted the black lung? Was it this mining company or was it another mining company? Like, why does it matter?
Typically they go by where you were last employed. I will also caveat by saying I am not an attorney, but I'm more than happy to have you talk to one of our attorneys. So I see a lot of this process, but I know that I don't speak on it fully. But it also matters because, you know, if that is not determined correctly, that could fall on the trust fund, and we don't want any additional funds coming out of the trust fund that don't need to. We want to make sure that that fund is solid for those that need it, for companies that have been bankrupted.
Yeah, and it's adversarial in the sense where coal companies are on the hook for the rest of that miner's natural life and perhaps later if the survivor gets those benefits. So that's a monthly amount the insurance, but it's convoluted, but the coal companies don't want to have to pay the bonds or the fees for that miner's benefits.
And I'll just add to and then I'll let Vonda speak. I'm sorry, Vonda. But, I'll just add to that the members of the community, black lung was caused because of insufficient safety in the mines. We don't want it falling on the trust fund. Members of the community want it to be coming from these coal mines that they worked at, that they should be paying for their benefits, as McGarvey and Casey stated. This is the opportunity for them to correct that wrong and to make sure their workers are taken care of.
Yeah, thank you, Courtney. Thank you, Quenton. Vonda, I didn't know if you had anything you wanted to add there. If not, we can go to some of the other questions.
Well, only thing I would want to add to that is with where I'm working with so many widows right now in Southwest Virginia. What we see a lot of times, if they're not if the miner hasn't got their permanent, if they have not went before the law judge yet and are still drawn through the Department of Labor, a lot of times if you've got it, in other words, if you've got it through the lawyer and you're good, the widow will receive her benefits. But what has happened a lot is either they still drawn through the Department of Labor and they haven't went before the law judge, and so the miner dies before they actually get to go before the law judge. And usually almost all the time that the benefits have been cut out for the widows. And I think with this bill being passed, it's going to help them and make the process so much easier. And that's what we want, to make it easier on them instead of them having to go through so much, what they actually had to go through with, losing their husband and then all the money and stuff. It's just too much. And I think with passing this bill, it's going to make it so much easier for the widows to be able to keep their benefits.
Thank you, Vonda. And
can I add something to that?
Yes, sir, Gary.
Yeah, and one thing, these companies filed bankruptcy, and they got to pay back into the black lung benefit, and it's millions of dollars that they get out paying into that because we ain't got no way to enforce them to put it back into the fund. When they file bankruptcy, we lose the money that they supposed to put into there.
Thank you, Gary, for the context. All right, we'll keep moving down the queue here and go to Liam with the Kentucky Lantern. Liam?
Hi, everyone. Thanks again for the time. This is a couple questions I had were more just clarifications. McGarvey's bill and Casey's bill, those are, I guess, renewed efforts of previous bills that have been introduced, or I guess reintroduced from past years, correct? In terms of what's the same with the legislation and what's different?
Yes. So for the Black Lung Benefits Improvement Act, it's the same bill except for it has 2024 and updated numbers compared to last year for the stipend. And for the Relief for Survivors Minors Act, it is the same bill, but we're super excited that it is in the House for the first time.
Great. And regarding the amendment by Representative Casey, the reason it would essentially cut out the funding for to be able to for MSHA to implement the rule, correct?
Yes.
Got it.
The amendment from Perry,
Just
by the way,
generally,
not Casey.
yeah, go ahead.
I was just saying that was the amendment from Perry, not Casey. I think
Yeah.
I
Oh,
mentioned
yeah. No, you're right. So, yep. Thank you. And I guess I was wondering, obviously no one has a crystal ball, but what have the efforts been like to reach out to GOP lawmakers, especially in coalfield states, to try to get more bipartisan support for such legislation and or oppose, the amendment by Representative Perry?
Yeah. So we are, of course, trying every day to try and get bipartisan support for both of these bills. That's why we're really grateful to have the Black Lung Associations in West Virginia, Kentucky, and Virginia, who are able to set up in district meetings with their lawmakers, trying to get support for both of these bills. In terms of a crystal ball, of course, I'm not able to give you a good answer for that, but they receive the same information that we give all lawmakers, and we are trying.
Thanks, Quenton, and thanks, Liam. All right. Next up, we have Justin Hicks. Justin, we'll get you unmuted and then take it away.
Hey guys, can you hear me okay?
Yes, we can.
Okay, great. Just gonna say, hey, first of all, to Vonda, Gary, and Courtney, and all those folks, how you doing? Good to see you all. I kind of want to pose a couple questions to our lawmakers here on the call, though, if that's okay. So for Senator Casey,
Justin, they did jump off, unfortunately.
They did jump off.
Yeah, I'm sorry about that.
Gotcha.
Glad to throw them to the field if you're still interested.
Well, I mean, sure. I would love. I'll throw it out there anyways. But I would love to know kind of what's actively being done at this point about that Representative Perry amendment. I mean, what is there to do and what can be done, right, to sort of try to block that Representative Perry amendment that would kneecap MSHA on the Silica rule?
And we've also got our colleague from Appalachian Voices, Chelsea Barnes, on the call, and she has been working a lot on the legislative side of things.
Yeah,
here,
sure.
So we'll just get her to jump in here. Okay. Chelsea,
can you hear me?
Yeah, we can.
Yeah, I mean, we've been talking to lawmakers, doing a lot of meetings and action alerts and things like that, just to really raise awareness about this. There have been so many amendments and provisions on the House appropriations bills that I think it's often very difficult for even other lawmakers to keep track of all of the various amendments that have nothing to do with, general government appropriations, but are attempts at blocking things like protecting minors' health. So I think, we're doing all we can to make sure, one, that, lawmakers are aware of this amendment. And in general, what we've heard from senators is that this is dead on arrival, that there's, this would never be considered in the Senate. We haven't gotten any commitments from Republican senators that they will block this or not allow it to be considered. So I think that's really key in our advocacy, as we're trying to make sure that we can get bipartisan opposition to this amendment. But right now we feel pretty confident in our senators on the Democratic senators that, are the sponsors on these bills, that they will ensure that nothing like this ends up in the final appropriations bills. But I'll just say that, for us to feel really comfortable, we want to see bipartisan opposition to this amendment, because we know that things can happen in negotiations, that compromises are made, and we could see something really, really disastrous end up in that bill, in that final appropriations bill, if we ever get one. And we're continuing to push on Republicans to make sure we have bipartisan opposition. I think it's just really, it's really notable that they don't even want to allow the regular rulemaking to go through the process. We see a lot of these kinds of attempts by Congress to block final rules, but it's really something special to see them block a rule from even getting to the final stages. MSHA hasn't even issued a final rule. So how do these industry folks know that they aren't going to like it? They had their opportunity to submit comments and hope, get the agency to see their side of things. So I think it's pretty notable that they're not even allowing the regular rulemaking process to go through before they try to fight this. It shows that they aren't interested in protecting minors' health. I'll leave it there.
Sure. No, and I thank you for jumping in to help respond to that. I wonder too if I might be able to ask as well about the Office of Workers' Comp had a proposed rule out earlier this year at some point about kind of the self-insurance regulations for coal mine operators, kind of making them have to have 120%, I want to say, of their liabilities covered so that they wouldn't burden the trust fund and make it unsolvent. And I want to say AppVoices or ACLC, I noticed one of you guys commented on that as well. Do you guys know the progress of that at this point, where that stands?
Hey, Justin. As of right now, we're still waiting to hear more. It's still in the rulemaking process.
Okay, it's still in the proposal sort of stage. It hasn't advanced since the last, was that April or something, I think was when they closed the comment period.
Right, in April. And in the new regulatory agenda, it's scheduled for a February finalization. Of course, those are always tentative, but that's when they anticipate finalizing.
Okay, got it. Okay, that's great. Okay, well, absent of any from the horse's mouth lawmakers, I think I'm good. Thanks, guys.
Thanks, Justin. And next we'll go to Mike Toney. Mike.
Thank you all taking time out. Just wanted to ask, following up on Liam's question from before, what kind of feedback, if any, you've gotten from West Virginia's congressional delegation? Obviously, Senator Manchin is on board, but the rest of the delegation, the GOP members in West Virginia, regarding the Black Lung benefits improvement legislative push and the amendment from Congressman Perry, if any, and what the nature of that outreach has been on your end. Thank you.
All right, I'm gonna take all the political questions here. I think we have certainly met with them about these two bills and tried to get their support, and have failed so far. I don't think we've gotten really any specific feedback other than concerns about the solvency of the trust fund is kind of the typical response that we have gotten. And that to us is not a reason to deny minors and their family members benefits. It's a reason for Congress to figure out how to make sure that there's enough money to fund the benefit system, not to leave coal miners and their families out in the dark without money for Christmas, as Vonda talked about. So that's, if you hear anything more specific when you talk to this office, we'd love to hear it. I think on the Perry amendment, we've really not been able to get anybody to give us any specific responses. It was a voice vote. It was not a recorded vote. It took place at about 11 p.m. And a lot of members of Congress weren't even on the floor for that vote. So we really don't know how they voted or if they even voted at all. So we've not really been able to get anyone on the record about whether they support that or not, other than Rep. Perry.
Thanks, Chelsea. And yeah, it's worth noting, I think it went around in the advisory, but the UMWA also had some members lobbying Perry's office on this, and so there's been a lot of scrutiny on this move by him. Next up, we've got Leah from Associated Press.
Hey,
Go
can you
ahead.
all hear me?
Yeah, we can hear you.
Hey, awesome. Thank you all for your time. It's greatly appreciated. Mike asked my first question, but this is a question for Mr. Hairston or anyone who wants to answer. But Mr. Hairston, he mentioned, Republicans love to talk about supporting coal miners on TV. It seems like the rhetoric from the GOP is increasingly that the Democratic Party is no longer the party of the working people, that Democrats have abandoned those principles. But obviously, when it comes to legislation like this, we are not seeing that support so far, at least. What are your conversations like with younger miners who are just starting out now in their careers? Are they frustrated by that lack of support from the GOP, or do they feel like the Republican Party has their backs?
Well, most of them right now, because they're young, they don't think they can get black lung. That's the way we thought when we was young, that we was nothing could stop us. And not until they really get sick from it will they even think about it. Because they say, well, I ain't gonna get black lung. As far as having the Republicans do it, when we had Manchin, they're kind of pushing. Capitol would go along with it when she's knows for her benefit, but when it ain't for her benefit, it ain't. So when we lose Manchin, we probably lose about everything, any kind of help we don't have.
Thanks, Gary. Does
Thank you.
anyone
I
else
really
wanna-
appreciate that.
Yeah, did anyone else want to weigh in on that one?
Well, I will in Virginia. I know with Senator Kane and Warner, we have great support in Virginia, but I've been working a lot with our congressman in Southwest Virginia, Morgan Griffith. And I know he supports coal, and he supports the coal industry and the coal, coal. But as far as supporting our coal miners, we've not really got any support with him on that. I know he voted no on the excise tax, and trying to work with him on different things. But he's good about doing that. But it's for the coal miners. I really don't feel like he's for the coal miners. And I've spoke with him several times, and I told him, I said, the thing of it is, if you don't have the coal miners in there working, you're not going to have coal, and you're not going to have a coal industry. So trying to, work with him on that. So been working with a lot of people in Southwest Virginia, having them call and leave messages and let them know that we need his support.
Thank you, Vonda.
And thank you to Leah for your question. There's a couple other hands up. Sarah and Mike, your hands are still up. I don't know if that means you still have questions, but okay, thanks, Sarah. Mike, if you had another one, I'll get you unmuted again as well. Just 1 second. Oh, no, okay, cool. All right, so seeing no other further questions at this time, thank you all for joining us. Thank you to Representative McGarvey and Senator Casey for their legislation and for joining us earlier today. If folks do have any follow-up questions or other background questions, please feel free to reach out to me. I'll put my email address in the chat here. Did anyone have any closing remarks? If not, we can wrap things up. All righty. Well, thanks to everyone for your time. Appreciate your attention to this issue, and we will keep you updated on developments on our end. You'll have a great day.
Thank you.
Take care.
Thank you for what you're doing for us.
Yes, thank you so much.
Thank you, Gary. Thank you, Vonda.
Thanks, y'all.
Thanks.